Carol, and thanks for the invitation to give one of the presentations for this series. I'm a member of the management committee for DRNI, and one of our aims is to provide, I suppose, service that's of use to network members, and also to bring along and encourage early career researchers. So I think there's a great series lined up, and I hope you enjoy what I have to talk about this morning. So I'm going to talk for about 20 minutes. So I might just hold the Q&A to the end. I don't have a lot of slides, but some of them are quite dense. So what I'm going to talk to you about, okay, and this isn't moving. Sorry, Carol, we did practice this, but my slides aren't moving now.
We did.
I'll do a new share, will I?
Say it again.
I'll do a new share. I'll just
yeah, good idea. Yeah,
it probably just hung for some reason. Hold on. Stop sharing, and then I will start again. And let's do that from the beginning as a slideshow. Okay, hopefully this works. Yes, sorry folks. So what I'm going to talk to you, cover this morning is give some kind of characterization of the social research landscape on dementia in Ireland, and an overview of the main areas of social research being carried out. I'm going to talk a little bit about impacting on policy, because I think that's an important feature of the work in this area. Again, just a slide on gaps and future research areas and some lessons learned. And I want to give a very clear health warning at the beginning, at the danger, risk of being lynched at the end, that I didn't mention somebody's research. This is not an exhaustive review. I've done my best to recover recent work that's going on, but I know I will have left somebody out, so I apologize in advance. So social research landscape is really very broad and covers a wide number of areas, as you can see here on the slide. I suppose one of the broadest and the key ones is health services research and evaluation. And that in itself is such a big area that I've just included a definition here. It's a multidisciplinary field, examines access to, use, costs, quality, delivery, organisation, financing and outcomes of healthcare services. The structure, process and effects of health services for individuals and populations. So it's a really big area. But I think also worth mentioning kind of explicitly is probably the more recent area of implementation research, sometimes called implementation science. I think the use and application and research itself of policy development and policy analysis, I think is a key feature of social research. In this and other areas. Health economics is another field of research in this area, which is very prominent. And there's a huge range of other forms and types of research. Longitudinal studies, particularly important. I know there's areas of legal and sociological research and so on. So it's a big area. I think there are also some key characteristics that it's worth exploring and talking a bit about. I'm going to spend a little bit of time on this. So by its very nature or definition, social research in any area, and particularly I think in dementia, shares these features. It's multidisciplinary. So you can have a psychologist and an OT working with an engineer, developing assistive technology. You could have a nurse and a physio working together to develop a new intervention and evaluating that. Almost any discipline working with a health economist to bring a consideration of cost to bear on their research. So it is very much multidisciplinary research. It's also very much multi-stakeholder, and I think that will become clear from some of the examples that I give in coming slides. It involves a wide range of partners. So we say the HSE. The HSE is a huge organisation, so divisions, layers, and different disciplines within the HSE are all different stakeholders, I think. The likes of the Department of Health and other government departments and other state agencies, NGOs, community groups, and so on. I have highlighted public and patient involvement. You might say, well, they're just another stakeholder. I think PPI thankfully has become an increasing feature of research in this and other areas. But I think as the end users of services, you know, we need to pay particular attention to involving the public and patients and service users in particular, and it really enriches the research we produce. I think it's fair to say that social research is particularly interested and concerned with policy impact. Policy is the way in which future service, you know, sets out what future services will look like and what's going to change or not in the future. So I think the focus of a lot of our research is concerned with impacting policy. I think we also need to acknowledge that the research we're doing is happening within a very complex system and context. So health and social care is a complex system. And I've just explored that a little bit because I think it's important for us to appreciate that. Complex systems in terms of kind of definition, they're very hard to predict. So this presents challenges to policymaking, evaluation and research. You know, there isn't a kind of a linear, simple one-to-one relationship in most of what we're exploring. Context and history are really important. So the same intervention could have different outcomes in different contexts, or if it's delivered in a slightly different way. And I think we've all probably been involved in studies where the outcomes aren't showing up the way we expect or the way we're experiencing on the ground. And I think that's a lot to do with context and different contexts. Most challengingly of all, complex systems are dynamic. They're changing all the time, and then within them they're adapting to the change that's happening. So they're never static, and most of our research designs go in almost on the presumption that nothing's going to change until we measure what we need to measure. And anybody again who's been involved in this kind of research appreciates that you know isn't the case. So we need to really start to engage with this complexity, I think, in terms of how we do our research. But just to finish out this kind of consideration of the environment, I think social research in dementia is also happening within a national context, which we need to be aware of in terms of policy, legislation, service structure and so on, and an international context. Again, there's an awful lot of work going on internationally. And I think networks like the DRNI in Ireland and Interdem internationally are really important for supporting that. So there are also a lot of different methods used in terms of social research. I'm not going to go through these, you're all well aware of these and probably more. I suppose one I want to draw your attention to is I think in terms of that engaging with complexity and looking forward to some of the challenges we need to address in the future, we need to start looking at innovative or more developed, sophisticated methods. I think methods like realist or developmental evaluation are really useful for engaging with complexity. I think service design is a very interesting discipline in terms of designing interventions and evaluating them. I think we're probably not using technology enough in how we do our research. I think creative methods such as the arts and so on could really start to change how we're doing research. But most importantly of all, my message is the importance of using mixed methods. I think from the characterization of the landscape, it's clear that the questions we're exploring are not just complex, but involve multiple stakeholders, multiple perspectives, and we need to draw on different methods to get the richest picture of what's going on as possible. Now, I have 4 slides here where I'm going to try and give, and I'm 8 minutes in, I'm going to try and give you an overview of the kind of the main areas of social research in dementia in Ireland, probably over the last 4 or 5 years. So I know there is other work going on that I've missed, but I suppose I focused on kind of main areas, significant bodies of work that are going on. So under the heading of health and social care services for people with dementia, So I suppose I'll give my own example first. In the Centre for Economic and Social Research in NUIG, we've partnered with the National Dementia Office in doing evaluations of intensive home care packages. And I know Austin Waters in the Health Service Executive and researchers in Trinity College Dublin are also looking at home care. In terms of daycare, we've also partnered, myself and my colleague Tom Pearce, with the HSE on examining dementia daycare. I know the Alzheimer's Society of Ireland, ASI, have very recently done a piece of work with the Work Research Centre and Maria Pearce, who's an independent researcher in the area, on examining daycare. There's work going on in terms of psychosocial and post-diagnostic supports, again in our centre, with Maria, along with the NDO as a partner, and Genio in the past number of years, and WRC also did work in this area, and I know others have done work in psychosocial and post-diagnostic supports. There's work ongoing in terms of the Dementia Cafe. And again, I think you're already seeing some of the partnerships that are evident here. The National Dementia Office, ourselves in Galway, and Engaging Dementia, an organisation that used to be called SUNIS. The UCC Centre for Gerontology and Rehabilitation, again, does an awful lot of work in a lot of these areas. I know they're particularly focusing on diagnosis and disclosure at the moment, along with the DSIDC in James's. O'Shea has done some really nice work, a Sphere PhD. I think she's a doctor now, on respite care and dementia, and that was across 3 institutions, and Trinity College and Genio did some work on respite in the past. I know Tony Foley in UCC is doing a lot of work on dementia in primary care, in terms of looking at training, but also registers, recording, and an awful lot of other areas. There's a lot of work going on in terms of dementia in acute hospitals. Again, the UCC Centre, the Irish National Audit of Dementia, the first and second phase is just finished. Dementia Care Pathways with Trinity School of Nursing and Marie Brady there in Trinity and Genio. And I know Trinity and Tala Hospital have also done a lot of work in this area. Residential care, again, the partnerships there, Trinity, DSIDC, Nursing Homes Ireland, the continuum of care. You can see the partnerships, I'm not going to read them all out. Palliative care and dementia, UCC, UCD and UU and other partners have a big study going on developing a model for palliative care and dementia. I know the Irish Hospice Foundation, the All Ireland Institute and ourselves have all done work in this area. Again, family carers, the de-stress study in Trinity Neil Centre and the ASI. Patricia Carney has done a study in this area, and UCD have done work on resilience, and I know DCU have as well. A big study on dementia prevention with Kate Irvin in DCU and others. Again, a lot of work on dementia awareness, dementia inclusive communities, loneliness. You can see the partners there. Understand Together is very good for some of these resources. My colleague Niamh Henley in Galway has also done her Viva on personhood and dementia. I suppose our centre has done a lot of work on a lot of economic research on dementia. Some of it there, cost analysis, cost effectiveness of some of the work on home care, on psychosocial support, and describing and resourcing optimal care. So that's an applied partnership study with the NDO and ourselves. Establishing public preferences for funding home care, funding models. Again, we've done work in that area, as have Sage Advocacy. And the ESRI do work in this area in terms of ageing, costs, demography, service use, as does the Irish Centre for Social Gerontology in Galway. There's a lot of work out there on dementia prevalence, registers, on estimating prevalence, and I know Louise in Hopper in DCU is a big piece of work scoping on dementia registers. Dementia and the arts, again, there's good bit of work in this area, but probably led mainly by Des O'Neill in Trinity and the University of Limerick. A lot of work on assistive technologies in Ireland and robots. So there's the Mario robot in Galway, Stevie in Trinity College. I know Dundalk Institute of Technology have done a lot of work in this area, as have the Work Research Centre, Genio and others. Environmental design and research, so the Centre for Universal Design and the NDA. I know Trinity did a lot of work on dementia-friendly hospitals, along in partnership with the Trinity Centre for Ageing. an intellectual disability. And sorry, the Dementia Friendly Hospitals was with Trinity Housing Research Centre, I think, anyway, Thomas Gray there. They've done some really interesting work. Other areas like legal issues, research on capacity and assisted decision making. So the Centre for Disability Law and Policy in Galway, the Law Reform Commission, I know Patricia Rickard-Clark does work on this, on SAGE advocacy, human rights, again, the Centre in Galway, and Suzanne Cahill in Trinity has an important book published recently on human rights and dementia. The Global Brain Health Initiative is a big initiative based in Trinity and partnered with San Francisco. And I know a lot of their work they're doing is in terms of kind of leadership in this area, but very multidisciplinary, including arts, clinicians, and so on. And we've got two big longitudinal studies, very important, on the island, Tilda and Nicola in the north. So that is, sorry, I know, a very, very quick, and I haven't done justice to any of that work. It's all really interesting, but I hope you can see, all the universities and many of the institutes in ITs in Ireland are involved in this, and the range of partners that are also involved. I want to just talk a little bit about the kind of influencing policy and how that works, and the policy research policy cycle, which is what's supposed to work in the ideal world, but it can be difficult to achieve. I'm just going to draw on an example from my own work here. So the National Dementia Strategy in 2014, one of the main action areas in that was to improve the range of services and supports available, and also look at greater integration of services and supports. And one of the initiatives launched and funded as part of the NDS implementation was the provision of intensive home care packages for people with dementia. So I led a multi-method, multi-stakeholder evaluation of the intensive home care packages. And we, in terms of the outputs of that, we worked very closely with the NDO and with senior management in the HSE to share the findings with them as that evaluation was rolling out. And at least partly due to the relationship that was built up over that time, we, in the course of this, also applied for an applied partnership study funding from the HRB with the NDO to carry out a study on optimal dementia care. So this was really looking in a bit more detail and a bit broader scope than just home care on what optimal care might look like and what the resource implications of that might be for people with dementia. We looked at dementia case types. So in this simple slide, I suppose it's difficult to portray the toing and froing, the ins and outs, as you know, goes on in the background with this, and the different dissemination methods and so on. So when I say targeted dissemination, the reports from the evaluation of intensive home care packages are publicly available, but we also did work like policy briefings and specific in-depth meetings where we could kind of talk through the findings in a lot of detail to really help breach that kind of research into knowledge use gap. And we're also then working on informing the prioritization exercise for the National Dementia Strategy for the next 5 years. So this work is feeding into the next iteration, if you like, of the National Dementia Strategy. So I suppose that's just one example of how that can happen. I also wanted to talk about influencing policy through public and patient involvement. We spent a lot of 2019 doing this work, and I wanted to share it with you because I think it's innovative, and it's very much co-produced and co-developed with a range of stakeholders, but very particularly people using services. So we kicked off this work with a policy symposium, which brought together a very broad range of stakeholders in the area of kind of aging and social care policy, and we're looking at social justice and future challenges. That was in April of 2019. Then we sort of jumped down a very in a very in-depth way with service users, and we co-developed what we called a policy cafe. And this was using World Cafe methodology to allow and enable people with dementia to have in-depth discussions on 2 policy areas that they chose, home care and diagnosis and post-diagnostic support. And we used film and animation, illustration, and traditional kind of report outputs to share outputs from that. We then convened a carers assembly, and again, great partnership work in all of these. With the Irish Dementia Working Group worked with us on the Policy Cafe and ASI and Carers Assembly. We worked with Family Carers Ireland, ASI, Western Alzheimer's, and brought together 30 carers of people with dementia, again, to help carers prioritise issues of importance to them. And we used the Citizens Assembly methodology for that. We brought the outputs, again, using film from these 3 events to a policy dialogue on the new home care scheme. And this was a very focused event which brought together a lot of policymakers from the Department of Health and other departments such as Public Expenditure and Reform and HICWA and so on, along with other key stakeholders and for service users. And used all of these events and used film, reporting, illustration to really bring a lot of research evidence, experiential evidence to bear on the development of the new home care scheme, which is underway in the Department of Health. So again, it's a very whistle-stop tour of a lot of work that's gone on, and working with partners, working with people with dementia, working with carers to ensure that their voice has as much impact as possible on new developments. And I think the home care scheme is going to be really significant in Ireland for the coming decades. This again is very kind of high level identification of gaps in future research areas. I mean, every one of the study areas I mentioned in those previous slides suggests future areas for research. So I've kind of gone one level up. Given where we're at and that this is a virtual webinar, I think it's wise to be prepared for the unexpected. So nobody saw, well, very few people saw a pandemic coming, and the impact it's having on how we're doing our work, on society as a whole, on families who are very directly affected. And also how the delivery of health and social care is going to change in the future. So, horizon scanning is really important, and being prepared to respond to challenges like this, because there are lots of less dramatic challenges and changes in the future. I think it is really useful as researchers to be scanning the horizon, to be a bit more aware of what's going on in our wider society globally, and in terms of kind of future scanning. So that might be in terms of what health policy is coming down the road. So the home care scheme is a really good example of that. That's going to be a very dramatic, hopefully, change to the delivery of a key plank of social care in the future. And there'll be, I think it's a really going to be a very rich area. We're going to really need to understand how that's working. Our demography is changing, the availability of carers is changing. So again, how we rely on families, what the role of families, family carers into the future is going to be very different. I think technology, is, and I'm not just, I talk about it in the next bullet, but I think things even like the Internet of Things, driverless cars, our world is going to change very dramatically in the coming 10 years, 15 years, and we need to be thinking about that. Work practices are going to change, and so on. I think the COVID crisis has really accelerated the use of technology in health and social care delivery. And again, as I think researchers in this social research area, we need to be ready to respond to that and to start to think about how we research that and evaluate that. I think we are increasingly paying more attention to implementation and applied research. but I think we need to do better on that. And I think using innovative or newer methods might help us to do that, to really engage with complexity. Things like network mapping, using technology to capture experiences. I think, again, there's a lot to be done in terms of how we collect data. You know, everybody's carrying around a computer in their pocket these days, almost everybody. So I think we could make greater use of that. That's very high level, very quick review of some potential gaps for the future. Just to finish on learning points, and this is drawn very much from you know, my own work and my own experience. I think engaging with complexity, I think we need to do that. I think we need to be better at it, and we need to keep abreast of innovative methods. To really be aware of the range of stakeholders in your area of interest. Look beyond academia, reach out to partners, and those partners are, you know, there's such a wide range and a great variety. And then build relationships with those partners and those stakeholders. And this is about, you know, not just going to conferences and events, but, you know, contacting people, sharing, you know, reviews you come across. A lot of people who are outside academia don't have access to journal papers, or they mightn't come across reports that are interesting or useful to them. And if you do, you know, send it in an email to somebody. It's a great way of just, takes minutes of starting to reach out in a helpful way to build those relationships. I can't say enough about how important public patient involvement is, and how much it enriches the research that we do. Certainly that's been my experience, and I know from speaking to others and the people involved directly themselves. And also the importance of democratizing the research process and making it's much more accessible. I think getting involved in networks nationally and internationally is really helpful for early career researchers and all researchers. And all of these activities, so all of these bullet points, this is the way you create pathways for knowledge transfer and exchange. This is the way in which you can have impact on policy and service development. I think we sometimes think of these as all, oh, that's my dissemination, that's my knowledge exchange plan, that's my networking, that's my policy impact. You know, these are all interrelated activities, and you know, the more we invest in them, the more we actually create those pathways then for our dissemination, for making knowledge transfer easier, and for having an impact on policy, which I think is what we're really all very interested in and vested in this area. I've just pulled some resources together that, again, you might find helpful and useful. DementiaResearch.ie is fantastic. It's pulled everything together from the last, well, from 2010 to 17, and a lot of other websites. I'm sure I probably missed some, but I think they're going to be helpful. And I will finish there in the interest of allowing time for questions. Sorry, I know I've gone over. I hope you found that useful. Thanks. And I will stop sharing so I can see everybody else, or see Carol anyway.
So just say thanks very much, Fiona. That was great. It's actually really interesting to see the breadth of research, you know, in a few slides. You know, it just shows the amount of activity that's going on, and some nice kind of practical tips as well, particularly for early career people and not so early career. So we'll open it up to Q&A. So if anyone wants to ask a question or even just make a comment, there was one comment there coming in about IDS tilde. I think you did include it in one of your slides when you were doing the overview. So
again, it is on the slide. Yeah, very important. And I know the team there in Trinity have also done work on service design and on residential care in terms of intellectual disability and dementia. Yeah, there's great work going on there.
Yeah, and seemingly there's over 10 years of research gathered at this stage, which is fantastic.
Absolutely, yes, yeah. It's a great resource. And again, one of the points I probably skipped over earlier in terms of data, quantitative data, you know, there's a huge amount of data already collected in Ireland. You know, it's a big undertaking to collect data in this kind of research area, and I think we don't make enough use of data that's already collected. So, and I know the Health Research Board, I think, had a funding scheme for a secondary analysis of data sets. So you know, again, look around, become familiar with data sets that might be useful, and also engage with the HSE in terms of using some of their administrative data and so on. You know, there's a lot of data out there that we need to make better use of, I think.
Yeah, yeah. And I suppose also just to mention on the DRNI website that there is a research database there. So for anyone who has carried out research in the area of dementia or Parkinson's disease or other neurodegenerative diseases, we can add them onto our database. So if people want to get in touch with me if their research isn't already there. So we have a question coming in. Are there particular international data repositories that you recommend?
I know that as well as being very fortunate of having, I suppose, 3 longitudinal studies on the island of Ireland, Nicola tilde and IDS tilde, you know, there are other longitudinal studies internationally, and I know that data is held. I don't know where it's held, but I know that data is publicly available from listening to Roseanne Kenny and Mary McCarran and others speak about it. And I know UCD is a data repository again for a lot of studies that have been carried out in Ireland. They hold a lot of data there. So I'm not too au fait with international data repositories, I have to admit. I probably make more use of national ones, but I'm sure they're out there.
Okay, great, thanks. There's another question. Could you talk a little more on your points about including people outside of and looking beyond academia in research and democratizing the research process?
Yeah, so I suppose, you know, for me, it comes down to the very nature of many of the research questions we're exploring in this area. You know, they're usually either directly concerned with the impact on people using services, you know, so we're looking at the effectiveness of an intervention, and we might be looking at some characteristic of people working in services in terms of how they do their work, and to me, the first port of call is to talk directly to either the end users if they're your cohort of interest, or staff working, and maybe beyond to representative organisations, the likes of maybe Alzheimer's Society or Western Alzheimer's, and talk to them directly about, so I'm thinking of doing research in this area. What are your concerns? What are the issues for you? And you can get a steer very quickly, that maybe what I was thinking wasn't the best way of either doing it or of most relevance, but a tangential topic is really core. And I think also then talking to people in the HSE who are running services, who are developing services, people in the Department of Health who are developing policy, to establish what the areas of concern are for them. And it's not simply about, how do we get more resources into our services? We need, that's obviously a very central issue of concern, but, moving beyond that, it is about, how do we ensure, for example, an equitable spread? So you'll see in lots of studies, the mention of postcode lottery, so there's an immediate issue of structurally, how do we ensure that services are available to people, accessible on a geographical basis, but within a specific resource envelope, and so on. So I think it really is about going and talking to people, and I know that can be difficult, but actually most people are really keen and interested in talking about the issues of concern to them, and you can find common ground usually very quickly. And the challenge then is probably to keep the scope manageable. We can't do everything in one study. We have to source funding and so on. But I think go out and talk to people and engage with them, and if they're involved from the very beginning, I tell you, they are so behind the work you're doing, and they are then the kind of vector, if you like, for disseminating your research when you have it done. But certainly involve them from the beginning. Don't go out with a fully fledged proposal and show it to somebody and say, "Oh, will you support that? Oh, and by the way, it's the proposal's due in tomorrow." I think we need to get beyond that. That's not real engagement. It needs to be built over time. And people think, "Oh, well, I can't think of that in advance." Start now. Just send an email to somebody, say, "I'd like to meet you for coffee and talk about, your areas of interest," because maybe in 6 months' time there'll be a call for funding or proposal or some work that's coming up.
Yeah, yeah. And actually, what's really nice is we've had quite a lot of, say, allied healthcare professionals signing up to these seminars, and people, from a clinical background. So it's great to see that real mix of people from the academic institutions and then also people on the ground, working day to day with clients and service users. So
yeah. I really think that you just learn so much from talking to and really engaging with, and maybe even just sort of shadowing, clinicians and people working in services for some time. You get that real on the ground sense of how things are working in the real world. And as a researcher, you think, "Oh, well, I'll do this and this and this, and that'll all work fine." And then you see actually how care is being delivered. You think, "There's no way that's going to work. I'm going to have to do something completely different." So I think particularly in the area of that first slide listing the range of different research types in social research and dementia, you do need to have an appreciation of how things are working in the real world, before you begin to design up your research. I think it is.
Okay, so I think that's all the questions and comments. So just say thank you very much again, Fiona. That was really interesting. And thanks everybody for joining us this morning. The next session will be next Tuesday with Dr. Barry Boland from UCC, talking about discovery research in dementia. And in terms of feedback, I'll collect feedback at the very end of the 6 sessions on all the talks. So actually it's just one chat, just make sure that's, that's just a thank you. Okay, thanks, Jennifer. Okay, take care, have a good day, everybody.
Bye-bye. Thanks, Carol. All the best, bye-bye.